Chapter 28 Oncology. A. Neoplasms. A neoplasm is an abnormal new growth of tissue. Malignant neoplasm cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth in the bowel. You have a small tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are other causes such as inflammation or fluid accumulation. Patients say, I have a lump in my left breast. Doctors say, there was a firm, palpable mass in the liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant parts of the body. Metastases. Neoplasms, which are the results of metastases, are called secondaries as opposed to the original tumor, which is the primary. We have the results of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of spread. So if we remove it, there is every chance of a complete cure. Note: to invite birth is to enter and spread through a part of the body, and this process is invasion known. If a tumor is described as invasive, it has the ability to spread. B. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of tumor. For example, a space occupying lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct, block the lumen, and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 33 years old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kg in weight. He was also complaining of night sweats. He had no significant past medical history. C. Treatment of tumors. A tumor can sometimes be completely removed or exist by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. See Unit 42. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. 28.1. Complete the table with words A, B, and C opposite and related forms, verb, nouns, and adjectives. Cure, cure, curative. Excision, grow, growing. Invasive, obstruct, obstruction, obstructive. Palliative, palliation. Palpate, palpation, palpable. Spread, spreading. Swell, swelling, swelling, and swollen. 28.2. The notes below are about the patient described in the opposite. Use terms to put the sentences 1 to 9 in the correct order. To make the next paragraph of the case report, use Appendix 2 on the page 20 if you need help with the abbreviations. OET 37.8 grades Celsius. Smooth, firm 3.44 cm. Mass in R. Subclavian fossa. Nodes 1 to 2 cm in diameter, palpable in both axillary and inguinal areas. Oropharynx and AD. P 100 for minutes regular. BP 112 and 66. CVS and ADRS and AD. AVD mass palpable 3 cm below L costal margin and CNS and AD. 1.7. There were enlarged lymph nodes in both axillary and inguinal areas. 2.5. On abdominal examination, there was a mass palpable 3 cm below the left costal margin. 3.2. His mouth and throat were normal. 4.6. On examination, his temperature was 37.8 grades Celsius. 5.8. His pulse rate was 100 for minutes regular and blood pressure 112 for 66. 6. 1. Examination of the central nervous system was normal. And 7. 3. There was a smooth, firm 3.44 cm mass in the right supraclavicular fossa. And 8. 4. His cardiovascular and respiratory systems were normal. 28.3. Complete the sentences. 1. Distant spread of tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. 3. The opposite of painful is painless. 4. A malignant neoplasm is called a cancer. 5. Tumors which do not invade or metastasis are benign. 6. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, palliative treatment should be given. 8. A pop of a liver suggests metastasis.